Psoriasis is a chronic condition that causes red, scaly, itchy patches on the skin. It can vary in severity and frequency of symptoms. Psoriasis often comes and goes in cycles. Your symptoms may worsen for a period of time, but then they can improve or even go away completely. However, they often come back at some point. When your symptoms are severe or active, it's called a flare or flare-up. If you go a long time without any symptoms, you may be considered to be in psoriasis remission. When we talk about psoriasis remission, we're referring to a period of time when your skin clears up and you don't have any noticeable symptoms. It's important to note that there isn't a specific guideline for what qualifies as psoriasis remission, as the symptoms and their cycles can vary widely from person to person. This can also be influenced by the type of psoriasis you have, with symptoms affecting the skin of people of color differently. This means that remission may be less likely or may not last as long for some individuals. In general, most periods of psoriasis remission last between 1 month and a year. However, there are some people who can remain in psoriasis remission for years. Psoriasis remission can follow successful treatment, but the results can vary widely for each individual. Treatment plans may need to be tailored based on skin tone, as darker skin tends to produce thicker lesions and may respond better to specific treatments. Some effective treatments for reducing or controlling psoriasis symptoms include topical medications, corticosteroid ointments and creams, salicylic acid, lab-made forms of vitamin D, and nonsteroidal topicals such as roflumilast and tapinarof. Oral or injected medications, steroids, retinoids, apremilast, deucravacitinib, methotrexate, and biologics are commonly prescribed for psoriasis. Light therapy, sunlight or UVB light exposure may be part of the treatment plan for moderate to severe cases of psoriasis. If this doesn't work, some doctors may prescribe oral psoralen and brief UVA exposure, known as PUVA. Some people also find relief with alternative therapies like essential oils, fish oil supplements, or aloe vera cream. A combination of these treatments could noticeably reduce psoriasis symptoms, possibly leading to remission. Other times, psoriasis may disappear temporarily for no apparent reason, known as spontaneous remission. Psoriasis is a skin condition that cannot be cured completely, and there is no guaranteed way to get rid of symptoms for good. However, there are ways to improve your chances of going into remission and staying in remission longer. One way is to avoid psoriasis triggers, such as stress, which is a common trigger for many people. Trying activities like meditation, walking, or relaxation may help reduce stress. Infections, which can stress or affect the immune system and trigger a flare-up. Injuries to the skin, such as scrapes, bug bites, or getting a tattoo. Weather, particularly cold, dry conditions. Other triggers include smoking, heavy alcohol consumption, allergies, and certain medications. To make your time of remission last longer or keep your symptoms under control, you can also try the following steps. Get a little bit of sun, responsibly, as exposure to sunlight can help psoriasis symptoms. Be gentle when cleaning your skin and avoid harsh scrubbing. Moisturize your skin using a moisturizing cleanser and applying moisturizer within 5 minutes of bathing. So, what does psoriasis remission look like? Well, it may be tempting to stop your psoriasis treatment if you think you may be in remission. After all, your symptoms have stopped or gotten better. But you should talk to your doctor before making any changes to your treatment routine. Stopping treatment can result in one of 3 possible outcomes. Your skin may stay clear and you may not have any symptoms, meaning you stay in remission. Your symptoms may return and look about the same as they were before. This is called a relapse. Your symptoms may come back and become even worse than they were before, which is known as a rebound. Your dermatologist can provide advice on what to do. Some treatments can be stopped right away without issues. But others may need to be stopped more gradually, or they might trigger a relapse or rebound. In the case of a rebound, you may experience a different type or form of psoriasis than you had previously, or your symptoms may change. Treatments that worked before may no longer be as effective, so you may need to adjust.